in the medical profession, a lot of men have had a lot of input and they don't even have uterus.
Why are we as women being dismissed when we try to talk about how we don't feel well during this transformational time in our life?
Health, wellness, longevity is very complex, and you need to be able to discuss it.
Hello, everyone, and welcome to the Hot Flash Health Podcast, where we're dishing out unfiltered truths about menopause with a side of sass and a sprinkle of crass. Get ready to dive into the wild world of hot flashes, mood swings, and all the other joys of being a queenager. No, this ain't your grandma's podcast. We're here to chat about our bodies, our passions, our fears, our desires, while navigating the roller coaster ride of menopause. So grab a glass of wine, or maybe three, kick back, and let's ride this hot flash wave together. I'm Courtney Mamuscia, and alongside me is my fabulous co-host, Fable. We're just two outspoken gals who aren't afraid to say it like it is. And because menopause is just another chapter in the book of life, we're here to help you write it your way. Now let's kick off today's episode. Dawn, why don't you go ahead and introduce today's amazing guest speaker?
Court, I've heard you say that like a million times, and it gets better and better and more personality and unbelievable every time. How did I get so lucky to have you as my trusty old sidekick? I'm going to blow this pop fan and you're going to run this thing.
Stars aligned.
So wonderful to introduce our incredible guest today, Patty Stewart. She is the owner of Shape Aesthetics and Wellness. I was very fortunate to have met Patty about a year ago through some mutual friends. And Patty and I have had the opportunity to talk offline about really what she's building in her practice and her experience. And she takes such a unique approach in what she's doing. Not only her experience in aesthetics, but really her approach with functional medicine and how she has approached the weight loss and semaglutide wave that we all are riding. Patty has 35 years in incredible experience, and we're so blessed to have you today on the podcast, Patty. So let's get real, because you and I have talked a lot about all of the problems that we are seeing as an industry, as consumers, around semaglutide, GLP-1s, Ozempic, tirzepatide. I know that's been a big part of your practice, and you are frankly one of the few that I have seen who is doing it right. So tell us a little bit about you first and foremost, and then let's get right into the vanity masterpiece in which I am a huge fan of semaglutide, as is Courtney, and let's dive into your knowledge there.
Thanks for having me. I really appreciate the spotlight. I started my career as a registered nurse in the intensive care unit, and then got my master's as a nurse practitioner and worked in subacute care. And about 8 years ago, started taking an interest in aesthetics. And then about 3 to 4 years ago, really heavy in functional medicine, and got my certification in functional medicine. And then when the peptides came out, it was very exciting for me to, of course, experiment on myself. And that's how I developed our program. I had a 6-month weight loss journey where I lost 65 pounds and really honed in how I felt with the medication. And then, of course, started treating my family. Now it's grown to, we get a lot of referrals from our patients. One of the biggest things that I noticed about these peptides is that you can't forget that they're a great tool in your arsenal for any inflammatory condition generally, including weight gain and hormones. But it has to be monitored by someone who understands the side effects and can really read your body and why you're not losing, why you plateau, because everyone plateaus and everybody stops losing and gets very frustrated. I like to call our program more than a weight loss program, but it's lifestyle training to improve your gut microbiome, inflammation, insulin resistance, and your metabolism. And it gives you tools that you can use without the medication if you so choose to be without the medication.
I think it's so important because I have a personal journey with semaglutide, and kind of exactly what you're talking about is I went to see a functional doctor. I didn't know you were around yet, but she's been great in my journey. And again, I've been having a lot of dietary issues, and she's trying to attack like what you eat and what you put in your body. Jumping into semaglutide, unless you're living under a rock, you probably have heard of it, but can you break down how semaglutide works in layman's terms for those of us who don't know?
Sure. Semaglutide is what is called a peptide, and a peptide is a signaling molecule. And I think that's important to know because our body signals each organ differently, and we have to know how to interpret those signals and understand when our body reacts to them. And our bodies do react to the semaglutide. So it works basically in three ways. It slows down your GI tract. And I relate how it works to the side effects that you have. So it slows down your GI tract first and foremost. So you feel full quicker and you stay full longer, which helps with hunger. It also has slower stomach emptying. So it causes things like nausea, sometimes vomiting, heartburn, especially diarrhea, and mostly constipation. And because we know how these medications work, we can predict their side effects. So we start people on some supplements to keep their GI tract moving consistently to avoid some of the nausea and the constipation concerns. The next way it works is in your pancreas, and it increases beta cell activity in your pancreas. Your pancreas is responsible for insulin production, and insulin helps to push sugar or glucose into the cell for fuel. So it really has to do with your metabolism. And the problem with insulin resistance is that your insulin does not work as well. And that happens when we gain inflammation and our body just doesn't function well as our blood sugars rise. So, again, one of the main side effects is a condition called pancreatitis. And it's a very rare side effect, but always has to be mentioned. And that's why it's important for a provider to guide you through those symptoms and understand when you have that issue. In the past 3 years that we've been doing these peptides, we've only had 2 people with pancreatitis officially, but it was related to gallbladder issues. And when you know the side effects, then you can stop the medication and really manage people better. But those people are back on the medication, and it's a kind of a short type condition. The third way that it works is in your brain, in your hypothalamus, which helps to improve hunger and cravings, mostly by affecting 2 hormones, leptin and ghrelin. It increases leptin, or your satiety hormone, and decreases ghrelin, which is your hunger hormone. And when it does that, and I think that's why this is the best tool around, it's because it takes out what I like to call the food noise. So you can walk by a bag of chips and not eat them and not even have a craving for them, which is a game changer when you're trying to do lifestyle changes and diet, because you can then really have more control over your food choices, which is a game changer.
Brings up an interesting point, Patty. In previously, when this first came out, the semaglutides and GLP-1 were really being utilized for obesity, right? Or someone who are diabetics. There is a term out there floating around about this fat bias, right? You have to be obese enough to gain access to these drugs. However, someone like myself, who's 46 years old, who's gained an additional 10, 15, 20 pounds, not feeling super confident, not feeling at my optimal self. Obviously, there's hormonal changes that are happening. Who is, in your opinion, a candidate for any sort of GLP-1 or semaglutide?
That's a good question. So, unfortunately, in the beginning, these medications kind of pigeonholed people into only being candidates if their BMI was greater than 27 or 30 or had a comorbidity like diabetes. What we found is that these peptides, again, are very safe overall if they're managed well. And I have a lot of clients who would not have insurance pay for their peptide because they're not in the diagnostic criteria for that. So I do have people who need to lose 10 to 15 pounds, especially postmenopausal women or perimenopausal women or in the throes of becoming menopausal. Because when hormones change, you store fat differently. I can't tell you how many times I've heard, all of a sudden when I turn 40, I can't seem to get rid of this last 10 pounds. And these medications are helpful because what I figured out in the big scheme of things, this is more than, again, a weight loss program. It's a fat loss program where we target fat loss, meaning subcutaneous fat, the fat you can pinch, and the visceral fat, which is the fat around your organs or the disease-causing fat, and save muscle if you do a couple of things a little differently. And if you, 25% of the people that go on any diet, people that go on any diet lose about 25% of their muscle generally. What people were doing on these medications is they were losing substantial muscle mass because, number one, they weren't hungry and they were liberated by not being distracted by food and not wanting to eat. So what they did was really starve themselves, and they kept going to the gym and kept doing their normal routines or not exercising and not eating. And that unfortunately puts you in starvation mode. So you hold on to fat and you lose muscle. And we saw that very early on in the process. So we modified our program to have high protein, low simple carbohydrates, a couple of biohacks to improve your metabolism, and then enhancing muscle training rather than heavy aerobics. So I have a gamut of people who need to lose anywhere from 5 to 8 pounds to 105 pounds.
Yeah. Personally speaking, it's been a miracle for myself, and I've been on it for probably close to coming on a year. And I have a fear of actually getting off of it because, like, I've done so well. I didn't have any stomach issues. But as that aside, how are you approaching long-term use of a semaglutide or its counterpart? Like, can people eventually go off, or how are you approaching the whole roller coaster ride?
Great question. And I get that question all the time because, of course, what we're all used to, especially gals our age, are the weight loss roller coaster. So you lose 20, you gain 25. That can happen with this as well. So again, these peptides are really great at helping with hunger and cravings. When you come off of them, you get that hunger and craving back. You can manage that, but it takes a lot of effort, and people do want a quick fix. And so what I have done, and of course I used myself as a little guinea pig too, I've come off the medication. So I lost 65 pounds. And of course, those hunger cravings came back in about 2 months.
Yeah.
But I gained 24 pounds back, tried some other alternatives, the oral medication and a couple of other supplements and peptides. And I'm now back on semaglutide because it's the most effective with my hunger and cravings. And I'm a stress eater. So, and if something's in front of me, I eat it. So what I tell people is that 90% of my clients who come off of this medication, they gain some weight back. I always tell them if they want to come off, I'll help you come off, teach you how to try to maintain. But if you start gaining, call me early. And then we get back on. Most people I have are on a very low dose. So we increase your dose based on your fat loss and your muscle gain. And once you get to your goal, we decrease the dose slowly. And then we find out how much you need, because everyone's different, how much you need to control your hunger and cravings to make good food choices. And that maintains weight because it's not hard to maintain if you have that help. It's harder to lose. So we get to our weight loss goal and then we come down off of our dosing. And we can dose at small mini doses every 7 to 14 days. But I never tell people go longer than 2 weeks, because then your GI tract starts to become an issue with that, because it speeds up and slows down, speeds up and slows down. So it's very manageable on low dose. And of course, then it's cheaper because you use less medication. And that's our overall goal with people, is to keep everyone healthy. These medications, I have helped people come off of diabetes medication, heart, blood pressure medication, cholesterol medication, pain medication. The whole process improves how your body functions. And we teach you how to understand your signals that your body's giving you so that you can manage them, and the dosing at home. So it's just a real-time look at weight loss and what you can do to help people maintain, because maintenance is easy to do if you have the right guidance.
Well, that's why I really appreciate your approach, Patty, is not only do you have the functional medicine background, but you're taking a very comprehensive sort of whole body approach, if you will, that is sustainable over time and looking at all areas of the body. So I appreciate that. And speaking of, this podcast is all about subject matter as it pertains to menopause. All of our hormones are changing. With that hormonal change, we're gaining weight, we're not feeling comfortable, our mental health is impacted. What is the connection between hormones and semaglutide and weight loss? Because I know something you offer in addition to your practice, which again goes back to the really comprehensive approach, is identical hormone replacement therapy. So can you help educate?
Sure. So most of our patients are women and peri and postmenopause. And we first get on the peptide. So number one, fat, whether it's visceral or subcutaneous fat, it acts like a hormone. So it changes the way your current hormones respond. Okay. And then we have the gut brain health, the gut hormone health, the gut emotion roller coaster. So we improve your gut microbiome by decreasing inflammation, and we put everyone through an anti-inflammatory diet because it's the easiest time to do it. Nobody even knows that they go through it because they're not hungry and they're not having cravings. So we do it all in the process to improve how people's body function. I always tell people, when you're looking at weight loss and hormone replacement to start, I don't start them at the same time. We start the peptide first, and we get the inflammation under control so that we really see if hormones are the issue or if it's inflammation that's the issue. And it's usually inflammation. People, in 2 weeks after improving that inflammation, their mood's better, they sleep better, sometimes poop better, everything. So, and they're happier. So depression is a thing too. And then after we lose the weight and get off some of the fat, then we talk about hormones and how people want to move forward. And hormones are very complex, and it can be done differently with everyone. And for women in particular, there's always this overriding question about whether to use testosterone or just estrogen and progesterone, or estrogen by itself. Do you have your uterus? Do you not have your uterus? There's a lot of things to think about. But what our program does is it helps to improve how we build muscle, improve your metabolism with the peptides, so that we can really figure out how each individual person would benefit from supplements of either estrogen, DHEA, progesterone, or testosterone, and then go from there.
Gosh, it's brilliant how you're combining all of this together in one practice, not to mention the aesthetics piece. This is like a match made in heaven for certainly me. I want Botox, I want hormones, I want semaglutide, I want all of it. But there's a lot of misconceptions, Patty, about hormones, right? A lot of women who we speak to are petrified of hormones because of case studies that were done years ago that have created a very negative connotation for hormones. Can you debunk or help make women feel less fearful of hormones?
Sure. So you're talking about the Women's Health Initiative study that really was a poor research study generally, because it really didn't identify that estrogen was bad for women. It's because they were given a progestin, which is a synthetic hormone, which is completely different than bioidentical hormones. So it really was not a good study to follow, let alone be the basis of everyone's education from there on. So medicine kind of did people a bit of a disservice there, I think. If I was going to give someone advice about bioidentical hormone therapy, you have to interview your provider, and hopefully they will help understand that it's not only about your hormones, but about how you're functioning and what your main concerns are. And then you can tweak and try out hormones at low dosing to avoid side effects, and of course get a very thorough history to improve how to choose which hormone will help each individual person and what their functional medicine intake is like. Many people have a varied medical history, social history, and family history, so that all has to be weeded out a little bit. So one other thing that I want to say about hormone replacement therapy is that estrogen is protective. Okay. So when I prescribe hormones for men or women, I always try to discuss the protective effects of estrogen for your brain, your heart, your bones, muscle growth, metabolism, mood. I think that it's important to understand that and know that it will help with longevity for most women. Okay. There's a lot of, as you said, 3 different forms of hormone replacement therapy. Really something you can take oral, something that goes on your skin, and then the pellets. I don't always go to the pellets right away. I think that that doesn't give a true picture of how people respond to hormones, because you can't control how it's administered or the dose. So women and testosterone, I would say, always start topically. You don't want to take oral testosterone. It's not as effective. But injectable testosterone is more for men, so to speak, and of course, higher dosing for men. For women, oral estrogen is okay, but the time released patches are really nice, and some women like them, some don't. And that's another thing that you have to discuss with patients. And then, of course, progesterone is oral, as we usually do that orally. Sometimes you also have vaginal types of applications. Vaginal applications of estrogen are good for people who have vaginal dryness, dyspareunia, or painful intercourse, because it works directly on your mucosa and it helps to improve both of those things. So it gives moisture and it makes your skin or your mucous membrane softer and less friable.
You're such an incredible wealth of knowledge. So talk to us about benefit of HRT and side effects of HRT.
Sure. So much like any medication, let's say, whether it's hormones or not hormones, people respond differently all of the time. And you'll hear a lot of women say, when I went on birth control, my mood changed, I gained weight, and etc. So you have to know that bioidentical hormone replacement therapy is different than birth control. It's a much, much lower dose. So people can tolerate it much better. But you still have to be patient with the process, okay? Because our bodies do not respond quickly. Like, for instance, if we give hormone replacement therapy, it takes 8 weeks after you change a dose to see if it really is working. Hormones are the same way. So it's important to understand that go low and slow is important so that you don't misrepresent how people respond. And then it's also important to have balance. So your hormones balance themselves. Estrogen and progesterone balance each other. So if someone's on estrogen without progesterone, you don't have that calming effect. There's different schools of thought about giving progesterone to women without a uterus because it stops bleeding and such. But now there's different schools of thought as to women, if they're on estrogen, should be on progesterone because of the balance. Also, dosing is important to understand that when your estrogen goes up, your FSH or your follicle stimulating hormone comes down. And we do those levels to make sure that we're not giving too much estrogen because you want to balance your hormones. Otherwise, your body's not going to respond in a natural way, if that's helpful. In the beginning, you should look at it more frequently, again, especially when you're trying to get the right dose. And the number is not as important as how people feel and symptoms or side effects or improvement of symptoms. So you have to kind of take it slow and use both of those gauges to dose people. For instance, progesterone helps with sleep. And some people, we always start with 100 milligrams. And if people don't sleep, I give it a good 2 weeks. If they don't sleep in 2 weeks, then we increase that to make sure that they have a response. So again, it's different for everyone, but everybody's level should not be a given number. It's not about the number. It's about trends and how your body's responding and how your other hormones are responding to the estrogen. For instance, don't forget, I said, if you give people estrogen, your FSH is going to come down. So you don't want to get your FSH below 25 because what menopause is a low estrogen and a high FSH. So what you want to do is you want to come down and make them normal so that your body feels better.
Patty, I've had a lot of girlfriends who have experimented with pellets. And their husbands or partners are petrified of them because they are coming at them like rage sex beasts or humping their walls. And their sex drives are absolutely off the chart. For many of us women who are in the throes of perimenopause or menopause where sex drives are being compromised, how does one know if they're a candidate for pellets or testosterone? And what are you seeing with your patients who are taking advantage of testosterone options?
Sure. So testosterone for women is good. Okay. But you have to understand that, and women have testosterone. We make testosterone. And what is important to understand is that testosterone breaks down into estrogen. So if you're getting estrogen and testosterone, you have to know that you probably don't need as much estrogen because you're making your testosterone breaks down into estrogen. So what I always do is to make sure you have a good sexual health history. I always start with topical and then move to pellets because you don't know what the dose is. The excitement for sex and the aggression with some women is related directly to the testosterone. And sometimes that also affects people's moods too. So if some women are more prone to being angry than sad, then you have to worry about that relationship as well. I mean, because it can affect how a partner responds to each other. So you have to understand that with the increase in sex drive also comes mood changes that maybe aren't ideal. So I always talk with women about that as well. Same with men. They get very aggressive with testosterone as well, and we give them more testosterone. You have to watch those parameters as well. But if the sexual relationship is healthy and thriving, that's a good thing. I usually see people at least every 3 months for the first 2 or 3 cycles, depending on how they do. And then if you're getting pellets, you're getting them every 3 months. So you do get your values checked before you have the pellet administration. That's how it's supposed to go. It doesn't always happen that way. But it just needs to be monitored in a reasonable and ethical way, is my opinion. Of course, there's always something new coming out, right? I'll tell you, ever since COVID, people have been coming in and saying, I've been on this Zoom and I see this, and I'm always going like this to get, yeah, exactly. So it's been a good marketing for us, for sure. We do a lot of things with aesthetics, and aesthetics goes along with weight loss too. If you lose a lot of fat, then you have loose skin. Hopefully, it finally catches up, and it usually does. But there's a lot of things to do that we do, and we just learned a new technique called Surgilift. So it's 3 procedures in one for a full non-surgical face and neck lift. We volumize completely with fillers. And then we do skin tightening with our Renuvion plasma machine. And then we use the stitch that goes all the way up here and hooks to this ligament in back of our ear. And then we tie it and you get that whole lift. So
Awesome.
it really is. So it takes about 2 hours to do and reasonably priced. I hate being in the aesthetics industry that is so high priced that people can't afford to do what they need to do. And when you lose a lot of weight, lose it in your face. So we decided to go with this procedure because it really fixed everything all in one shot. And then we bring you back for skin health. So we do botanical enzyme masks, and we have lasers that help with color, texture, fine lines, wrinkles, etc. And then, of course, we do Botox.
You can never get enough Botox, right? Or maybe you can.
No.
Speaking of that, we're walking around, and I happen to see a lot of women these days that are doing far too much to their face. It's too much, where they're like looking like Michael Jackson. I mean, it's horrifying. Someone who's looking to enhance their youthfulness, but still really look very natural. What is the best procedure for that? What is the most sustainable way? What is the beautiful way to age while taking advantage of some of the progression of technology out there and being able to look good, but not look like Michael Jackson?
Right. So in my practice, we do what's called stacking technology because nobody needs one technology. There's multiple issues with collagen production, inflammation, your gut microbiome, because we fix the gut and then it helps the skin, of course. And then some people have more color issues than not. So we usually take 3 different technologies and put them together in a package so that you get more bang for your buck, so to speak. And then that's why we like the Surgilift right now. And a lot of our weight loss patients are our aesthetic patients, so we know their history. Of course, we get a history from our aesthetic people, but you have to know that sometimes biostimulators like Sculptra and Radiesse that build collagen are not the best choice for people who have collagen disturbances or inflammatory conditions or autoimmune conditions because they won't get the benefit as much as someone else would. It's just like everything else. You have to know what's going on with people, what they need and what they have that bothers them, and then you fix that for that person. Okay? People will have the Surgilift and do well. Other people will do well with Sculptra and biostimulators. That's what I have in my face is Sculptra. But I'm going to get the Surgilift But
That's so cool because there's people spending thousands of dollars on perhaps treatments where their bodies fundamentally and internally are not responding. So the fact that you do all of this from looking at the inside, really taking a look at the data, taking a look at the full health history, taking a look at a comprehensive approach, and then recommending that aesthetic that's going to speak to you and how your body responds.
yeah,
No brainer.
right. Yes, I'm your partner.
Patty for president. God. I know we're running a little bit. I want to be respectful of everyone's time. We would love to have you back on because I feel like you are such a wealth of information. One of the things that we talk a lot about at Hot Flash Health is menopause as a subject matter and how it's been so dismissed and how there is so much stigma around it and how there is no true expert physician resource to really deal with menopause and how we as women are all settling to just sort of feel mediocre, right? At your practice, you do not do that. Can you talk about a little bit what's happening in the industry and why women are being so dismissed by their physicians when they go and try to share their vulnerabilities around symptoms and menopause and how they're not feeling the time? Like, why are we as women being dismissed when we try to talk about how we don't feel well during this transformational time in our life?
Well, it's very complex, in my opinion, being on the Western and Eastern sides in that functional medicine realm in the middle. First of all, a lot of providers were misinformed. Okay. The Women's Health Initiative, of course, that was where the estrogen was legal. So you have to know how to choose the research that you're using to treat patients. And our medical profession, of course, I'm a nurse practitioner. So in the medical profession, a lot of men have had a lot of input and they don't even have a uterus. So, and you have to understand that people respond. This whole functional medicine topic is new for a lot of people. And Western medicine does not necessarily recognize functional medicine providers because they look at the gut. They look at how your body signals different pathways to function well. And if one or two of those things are off, then your body is not functioning as a whole. So looking at the whole person in a holistic sense and trying to improve all those things is important. And I think that gets missed because providers don't have a lot of time either to spend with people. I think they have a 20-minute slot. And if you have 3 big issues, you get the one that's most important. And then you come back for another visit maybe in a month. So what is different about my practice and the way I take on clients is that I spend an hour and a half with them and really go through everything. I get their labs and I look at what's optimal, not normal. Okay. You want to look at optimal values.
Yay.
Yeah. And that's the same thing with hormones. And I think that there's a lot of conditions that can mimic hormone issues, depression, lack of sleep, fatigue, fibromyalgia, thyroid issue. And you have to do the testing on all of those things and also fix the hormones. So if someone's thyroid is messed up and you fix their hormones, supposedly, according to numbers, it's not going to make them feel better. You have to address both issues. And that becomes a longer appointment. So you really want to pick a provider that gives you the time that you deserve instead of coming in and, oh, I'm so fatigued, I'm gaining weight. Oh, it's your thyroid, but it's really your hormones. And then they don't address the hormones. So health, wellness, longevity is very complex. and you need to be able to discuss it with your provider. And if you're not able to do that, then that's not the provider for you. We're going to start having group visits. So having interactions. We have a beautiful spa here in a nice big open area that I invited Dawn to come to our first group meeting in a couple of weeks. I think it's important to be able to explain general concepts that, I say the same things all the time. And if I can get 10 people together, say the same thing, and then have them all ask their own questions and everybody learns from that, I think that's very valuable. It's good education and people remember it better. If you're interacting in a group with some food and in a very safe environment, I only think that can be better. So that's what we're going to start doing for health, wellness, hormones, fat loss, all of it.
Love
You're
it. Hot
excited.
Flash Health will sponsor.
Oh, yeah. Perfect.
With that being said, aside from Patty for president,
I've never applied to that job ever.
How can one find you if someone is interested in learning more about your services and seeing you as a functional medicine doctor in pursuing aesthetics or semaglutide? Where does one go to find the incredibly talented and amazing Patty Stewart and Shape Aesthetics?
ShapeAesthetics.com is our website, and it's got a lot of information on it. We have texting and our phone number. We have people who answer the phones. Reaching out that way is fine. I always am one that if you want to come by and see the place and really understand what we do, we have time to just chat with you.
Do you do anything via telehealth or
Yes,
things
we
like
do
that?
telehealth. We have people in a lot of different states.
Awesome. Good. Well, we will have you back for sure. You have been such a breath of fresh air and have such an interesting and different approach. And we really appreciate it. I absolutely will be taking advantage of many of your services in the near future, as I know my trusty sidekick will too.
Well, you guys are great. So thanks for doing all that you do. And thanks for having me on the show. And hopefully you guys can come by and maybe be some models for some aesthetic treatments.